Today I'm going to talk about bony, orbital, and skull-based anatomy and pathology in coronal CT planes. Basically, this is a brain that was cut in this plane that was displaced in this view. This is called coronal plane, and it is very good to evaluate skull-based anatomy. So here I'm in the front of the brain, barely cover the nose. I'm scrolling backwards towards the back of the head, and here I'm seeing the nasal bone that sometimes they get fractured because of this quite protruding structure in the face that frequently got injured. Here are the frontal sinuses and the bilateral eyeballs, and here are the space for the brain. Notice that the skull base, which is the floor of for the brain, are quite rough, bumpy. So when the brain is shifting, such as in a motor vehicle accident, that can be contused, means injured, because of the floor is not smooth. So the frontal part of the brain, especially adjacent to the skull base, are easily injured. I'm keep scrolling towards the back. Now I'm seeing some ethmoid air cells. They are pretty much they are also part of the paranasal sinuses. They contain air, and they could cause sinus disease, usually infection, either bacteria or fungal infection. So here we can see a tube, the bony tube, coming from the medial, towards the center part of the orbit, drain the tear that's produced in the lateral superior part through the eye, wash the eye, and drain through this nasal lacrimal duct. So when you is crying, and then the tear is made here and drain into the nose, and you have to blow your nose. Some patient, especially young patient, they could be blocked here, so and they will have some backed up material that you will see during the day as a dried up material in the medial part of the eyeball, and they have to make a surgery. Actually, they use a tube just to open it up, and they will start draining again. And then here are the medial part of the medial part means the medial means towards the center of the body. So here the medial part of the bony orbit, which is the bone socket for the eyeball and the supporting structures. They are the ethmoid air cells, and they have little septations within the air cells, they causing reinforcement. So even though the bone are very thin, when the eyeball got injured, they doesn't break this part of the bone usually. They usually break the floor of the orbit, and I will show you a case later. But because the bone are paper thin, it's called lamina papyracea. It basically means paper thin bone, and then there are veins across those bones. They do not have valves, so they kind of a two-way street. So bacteria or fungus from the sinus disease could easily pass into the orbit and causing orbital infection, which is serious because it is threatening the vision. And here is a cristic alley, a more prominent bone in the middle that's function as attachment for the falx cerebri. And then here are the skull. The skull have two layers: the outer table, the inner table, and the medullary cavity. Basically, the stronger part is the solid part, outer and inner. In the middle part have some holes and septations, so the marrow stayed in there. And the scalp, the skull, and then the brain. Keep moving more posteriorly towards the back, and then here are the maxillary sinus, only partially seen, and then the sinus drain through this infundibulum back into the nose. If this part is blocked, and you have sinus disease. And this is a little bony canal for the infraorbital nerve. The same thing for the other side. Keep moving posteriorly. And this two cavity, not recess. It's basically it is a fossa, which is a space for the olfactory nerve, cranial nerve 1, which send a little small nerve through this cribriform plate, which is here, into the nose, which detect the smell. Basically, the little molecule that's from food or whatever that you sniff up into the upper part of your nose, they will contact those little nerves and then send signal back to your brain, so you know what it smells like. That part can also be broken because then if there is a tumor involving the olfactory nerve, such as esthesioneuroblastoma, neuroblastoma, that can easily grow towards the brain and through this bone into the nose. Moving more posteriorly, and here we are moving. This is the back side of the eye. Here, the sphenoid bone. This is called a sphenoid wing, the greater wing of sphenoid bone. And here are the inferior orbital fissure. Here are the superior orbital fissure. This little hole that connect the brain to the orbit contain the optic nerve, where our vision going through this canal. And then here are the clinoid process. Basically, that's a marker for the internal carotid artery. If once they pass this area going superiorly, upper part is in the arteries in the dural sac, within the brain parenchyma. I'm sorry, within the cover of the brain, within the dura. Here are the sphenoid sinus, and this is a hole for the cranial nerve 5, second division, the maxillary division. Same thing here. It's called foramen rotundum. This is another hole. It's called the Vidian canal. Basically, it's a connection between the cranial nerve 7 and the cranial nerve 5. That's a more complicated. They meet together in the pterygopalatine fossa. And the cranial nerve 5, which is the trigeminal nerve, the third division, the mandibular division, exit through this hole. It's called the foramen of ovale. This is more anterior. This is in the pituitary fossa, sella turcica. They are the same thing, where the pituitary stays. And moving more posteriorly, here are bilateral temporal mandibular joints. They are involved in moving of our jaw, talking and eating, and if you have pain there, you cannot open your jaw well without pain. And this hole is for the internal carotid artery that supplies the brain. Same thing here. It's called foramen lacerum. Here are some black area which containing air. They are called mastoid air cells. Mastoid sinus disease happen here. They supposed to communicate with oral cavity via the eustachian tube. So here you can see the ear lobe. Here's the external auditory canal, which is the hole that we've seen from the outside. This is a very thin membrane that separates the outside of our body to the middle ear cavity. There are 3 little bones, very small bone, the smallest bone in our body. It's called the middle ear ossicles. They basically convert the vibrational motion from the sound into vibrational movement into a little place called an oval window right here. And then the oval window will move along with the sound and cause more wave changes into a cochlea. Basically looks like a snail shaped thing, like here, like figure 9. It detects the wave that separate into high frequency, low frequency, and then transmit those wave motion into electronic signal as nerve signal and send it back to the brain as our cranial nerve 8, cochlear nerve. Cranial nerve 8 also have a vestibular nerve which transmit information for our balance, for our body position, location information. They are detected by the 3 semicircular canals. So we know our body position even with our eye closed. Within the cranial nerve 8 and cranial nerve 7, facial nerve, they both all go through this canal. It's called internal auditory canal into our brain. This external auditory canal, middle ear cavity, internal auditory canal, and brain. This is a calcification within our pineal gland, which is associated with, the calcification is associated with aging. The older we are, the more likely we have calcified pineal gland. They regulate sleep, wake cycles, and seasonal changes in animals. They are associated with hibernations. So they, even though they don't see the light, they do regulate our kind of a timing of our body. Some animals, they can detect some light, especially if there is a hole between this gland and the outside of the body. So this is our third eye. Okay, here are the internal jugular vein that are going through this canal. Bilateral mastoid air cells. So this patient has a baseball injury. I borrowed this diagram from the web, basically showing the baseball hitting the eyeball, and the eyeball have nowhere to go but going through the weakest part of the bony orbit, typically the floor. Buccal fracture, and then this person had such injury. And then we can remove the skin and the soft tissue and see a fracture in the inferior part of the bony orbit. This is a separate patient, alcoholic patient that tangled with bed sheet at night when went to bathroom, fell, face hit the wood bed frame. Same thing, just like the baseball. Eyeball pushed in. This is on the side view, sagittal view. Nose, back, top, bottom. Eyeball push in, fracture this floor of the orbit, causing a lot of blood and mucosal thickening of the maxillary sinus. And then this bone fragment can function as a trapdoor if there is anything that herniated, that means moving downward, so to prevent them from coming back. For example, this patient only have the fat herniated down through, so his eye vision and eye movement are not affected. If he's not lucky, this inferior rectus muscle that herniated through this defect and trapped by some kind of bone fragment, then he cannot really look down, and because that muscle doesn't work anymore, and therefore he will have double vision, and that need a surgical repairment. This is the left side is normal. Oh, by the way, this patient also have nasal fracture. The nose bone was deviated toward the left side. This is the left side of patient, right side of patient. This is axial view. The eyeballs are here. The tip of the head is into the screen and the foot is towards us. So this is a nasal bone fracture, and in addition to the orbital fracture. These are the streaky artifact from fake imaging things that, because of the CAT scanning plane, the dental amalgam causing this artifact everywhere. And this patient has, I got it from the literature review. And this is a subperiosteal abscess due to ethmoid sinus disease. As I told you, that the infection, the bacteria went through this thin bone, lamina papyracea, and into the orbit, and that could spread. That first can cause compression of the orbit, and the compression causes ischemia, like lack of blood flow to the eye, or the bacteria can directly spread to different part of the eye. So that need aggressive antibiotic treatment, treated more aggressively than infection that's only on the eyelid. This part of fat within the orbit is inflamed, looks strandy. This is normal. So there is not only the periosteum inflamed, the adjacent fat is also inflamed.